Okay, I would like to introduce myself. I'm Thomas Puckett, and I will be presenting you with a PowerPoint presentation on basal bolus insulin versus the use of sliding scale insulin. Um, where should I start? So let's begin. I'm sorry, I'm a little crazy today. All right, so the problem I pointed out in the slides is the fact that we still tend to use sliding scale insulin therapy as the treatment for hypo or hyperglycemia, and some studies have proven that the use of just basal bolus insulin is much better, and this helps the patients that are especially those who are going home that needs to self-medicate themselves. They can manage it better with just a couple boluses a day compared to having to give the sliding scale insulin with each meal. And it's also I plan to show that the research has shown that basal bolus insulin maintains the blood glucose levels at a much better therapeutic level. So the PICO I wrote, the question is, or the way my PICO question is, the PICO is the adult patients with diabetes. That's intervention is basal bolus insulin, and the conflict there is the use of sliding scale insulin. So I plan to prove that basal bolus insulin actually improves the glycemic control compared to sliding scale insulin. Significance to nursing is the fact that I believe that the nurse's role is to assist the client with self-care practices and to maximize self-care abilities. And so you want to be able to get the patients the ability, the autonomy that they need, and have them in control. And that is our role as nurses, is to try to prepare our patients to have more control in their management. And one of the steps, or one of the ways I plan to show, is that basal bolus insulin, it's a good way of helping them be able to do that in a much easier way. So when I did my search, I searched on Google, Public Medicine, ProQuest, British Medical Journal online, Medical Journal of Australia online, and then our school Episcopal Coast, I guess that's what you call it. And that's what I had to put in: basal bolus insulin versus sliding scale insulin to get a accurate response on journals that will apply to what I was looking for, and that pretty much narrowed it down to specifically those particular journals that was going to qualify. And so my personal interest is in this is because I work in healthcare. I work for a company that provides care to patients in nursing homes, and also we do have patients that come to the clinic, but most of our patients are short-term rehab patients, and they are in nursing homes for rehab, and then we're sending them home. And so they're actually going in the hospital. They probably already have, or usually they have, the diagnosis of diabetes, but if not, they're starting on insulin or other agents, and then they come to the nursing home, and the role of the nurses in the nursing home, and our role as the practitioners coming in and managing their care, is to try to get them prepared so that they can go home on a treatment that is manageable for them. So the synthesis I noticed was that all of the journals looked for the target range, had a actual target range of the blood sugars. The study groups, those that were on basal bolus, were less likely to experience hypoglycemic levels in comparison to the control groups. And then the study groups also on basal bolus were less likely to experience hyperglycemia in comparison to the control groups. Every study I read had target ranges that were intact, and hypoglycemic and hyperglycemic was less likely to happen. And this happened in all variables according to the journal. So it could have been patients that were having surgery, patients that were on enteral feeding, etc. So in conclusion, according to the American Diabetes Association, the standards of medical care in diabetes does not support the use of SSI or sliding scale insulin for controlling hyperglycemia, and its cause of rapid fluctuations in blood glucose levels. The American Diabetes Association does support the use of basal bolus insulin therapy, most importantly because it mimics the body's natural delivery of insulin. Thank you so much for watching my presentation.